Hello everybody, my name is Dr. Peter Sebeny. I'm an infectious disease specialist here at Anna Jaques Hospital. As you know from the public health crisis we are now under, we're dealing with the coronavirus pandemic. I'd like to speak to you briefly today about the transmission of coronavirus and what we can do as a community to keep ourselves well and prevent transmission. As you know, coronavirus is generally a respiratory illness which has a similar transmission risk as influenza, in that most of the transmission occurs when an individual is infected with coronavirus and can spread it through what's called droplet nuclei. These are small particles that can be expressed from the nose or mouth when someone talks, sneezes, or coughs. Those small droplets can transmit in the air over a very short distance, usually 3 to no more than 6 feet. Usually what would happen is the other individual would either inhale those particles or potentially touch those particles and then inoculate themselves by touching their own face, nose, mouth, or eyes. There is some concerns that surfaces can be a source of transmission. This is probably a very small source of transmission, mostly from breaks in traditional hygiene. For example, if someone were to cough or sneeze on an object or on a table, and somebody comes up behind them and touches it and then touches their own eyes, mouth, or face, it can be transmitted that way as well. What is critically important, particularly in this time of the pandemic, is to really stick with social distancing. The idea is that by maintaining a healthy distance of 6 feet from others, that you will greatly reduce the risk of transmission, even if somebody is near you who is infected that coughs or sneezes or the like. This is also important because there has been some concern raised about asymptomatic infected patients being able to transmit the virus. We do think that this may be possible. However, if you keep to good social distancing, this will be less of a concern for that individual.